You know that feeling? You go to the doctor for what seems like a simple cough, and suddenly you feel like you're in an interrogation room answering a million questions. Well, there's a really good reason for all that. Your doctor is basically a detective, and your symptoms, those are the crucial clues they need to crack the case.
What feels like just a cough to you is actually the first thread your doctor pulls on to unravel a potential medical mystery. We're going to follow that thread, just like they do, and see how the answers you give help build a complete picture of your health.
So every good investigation has to start with the main piece of evidence, and in our case, that's the cough itself. Let's dive into Section 1, decoding your cough.
The very first question is almost always about timing. So, how long has this been going on? The answer you give immediately puts your cough into one of two categories. An acute cough, one that lasts less than 3 weeks, usually points to something short-term, like a common cold or infection. But a chronic cough, one that's been sticking around for over 8 weeks, well, that signals to your doctor that they need to start digging a whole lot deeper.
Now, this is where it gets really interesting. The specific time of day your cough acts up is a huge clue. An early morning cough, that's a classic sign of the kind of inflammation you see in smokers. If it gets worse in the afternoon or evening, that could point to something you're being exposed to at work. And if it's waking you up in the middle of the night, the prime suspect there is usually post-nasal drip. Each timing points the investigation in a different direction.
Next, the detective listens closely to the sound of the cough. Think about it. A hacking cough might suggest something like walking pneumonia because of how it irritates the airways. A dry cough could be an early sign of heart failure as fluid backs up into the lungs. Through a stethoscope, a doctor might hear a fine crackling sound with that. Then you've got that very distinct barking sound, especially in kids. That's a hallmark of croup. And a congested, rattling cough, that tells the doctor there's probably mucus in the larger airways, which they might hear as a low-pitched snoring sound called raunchy. Each sound has its own unique audio fingerprint.
Physical evidence is absolutely key. So if you're coughing something up, its color is a major clue. White or clear often points to a viral infection. Yellow or green can signal that bacteria have joined the party. A rust color is a serious red flag, pointing towards infections like tuberculosis or a specific type of pneumonia. And if it's pink and frothy, that can indicate pulmonary edema, which is fluid in the lungs. It's like forensic evidence telling a story.
Okay, but the investigation doesn't just stop with the cough. A good detective always looks for accomplices. In Section 2, we'll explore some related clues, issues with your breathing, and any pain you might be feeling.
Shortness of breath, or what doctors call dyspnea, is such a critical clue. But just saying, "I feel short of breath," isn't really specific enough for the investigation. Your doctor needs to quantify it. What brings it on? How far can you walk before you feel it? 1 block? 2? Can you climb a flight of stairs? Pinpointing that level of activity helps figure out the severity and can point towards a respiratory, cardiac, or even a neurological cause.
So, has a doctor ever asked you how many pillows you sleep with? It seems like such a random question, right? But it's not small talk. They're actually checking for something called orthopnea, which is just a fancy term for having trouble breathing when you're lying flat. If you find yourself needing 2, 3, or even more pillows just to breathe comfortably at night, that's a significant clue. And here's another crucial nighttime clue. It's called paroxysmal nocturnal dyspnea. It sounds complicated, but the experience is terrifyingly simple. You jolt awake from a deep sleep, gasping for air, and you have to sit or stand up just to catch your breath. An event like that is a major lead for your doctor.
When pain enters the picture, location is everything. Can you point to the exact spot with one finger? If you can, it might just be a strained muscle from all that coughing. But if the pain is more widespread, or if it feels like a deep pressure, well, that's when the investigation starts looking at more serious things, possibly involving the lining of your lungs or even your heart.
At this point in the investigation, the detective zooms out. They go from looking at the immediate symptoms to building a complete profile of the case. And that brings us to Section 3, building your health blueprint. Your personal and family history basically create a case file of potential risks. Do you get a lot of colds or have you had pneumonia before? That matters. Does your family have a history of allergies, asthma, or even tuberculosis? These are all critical risk factors that help the doctor understand what you might be predisposed to. Now, for any cases that involve smoking, doctors have a very specific and supportive protocol. It's not about judgment at all. It's a structured process called the 5 A's. They'll ask about your tobacco use, advise you on quitting, assess how ready you are, assist you in creating a plan, and then arrange for follow-up. It's really designed to be a partnership.
And here's why that conversation is so important. This chart shows the incredibly strong link between smoking and COPD. That's chronic obstructive pulmonary disease. It's a group of lung diseases that block airflow and make it really tough to breathe. Smoking is the prime suspect in most cases, but, and this is important, it's not the only one. The investigation has to consider all possibilities.
So what are those other possibilities? The detective's next step is to investigate the scene, your environment. And the list of potential environmental suspects is pretty long. Where do you work? A coal mine, a farm, a factory? Do you live near a busy road with lots of traffic? Exposure to things like asbestos, radon, or even certain pets can absolutely be the missing piece of the puzzle.
This all brings us to our final, and maybe the most important part of the whole investigation. Let's look at Section 4, your role in your care.
You see, a great detective doesn't just solve the current crime. They help you set up security for the future. And that's exactly what proactive care is all about. It means staying ahead of potential problems by keeping up with things like your flu and COVID vaccines and getting recommended screenings. It's really about preventing the next case before it even starts.
A good detective also knows their line of questioning has to adapt with age. For older adults, the clues might be a lot more subtle. Instead of a big, dramatic cough, the investigation might focus on new fatigue during daily chores, or a noticeable drop in how much you can exercise, or even unexplained changes in your weight or energy levels. The body just sends different signals as it ages.
Ultimately, this whole investigation is a partnership. It has to be. Your doctor has the medical training, for sure, but you have the clues. The more details you can provide, the more accurately they can solve the case. So next time you see your doctor, remember, you're not just a patient, you're their key partner in the investigation. So the question is, what clues will you bring?